Chapter 25, Patient Education. Patient education is one of the most important and vital nursing interventions in any healthcare setting. It's by education that nurses empower the patients to prevent acute and chronic disease, decrease disability, and improve their overall wellness. Part of patient-centered care is to integrate educational approaches that acknowledge the patient's understanding of their own health. The goals of a well-designed, comprehensive teaching plan will include providing a good fit with each patient's unique learning need, reduce healthcare costs, improve the quality of care, and ultimately change behaviors to improve the patient outcomes. Patient education through active patient participation and decision-making is an essential component of providing safe, patient-centered nursing care. Not only can nurses provide knowledge in terms of health maintenance or disease management, but nurses can also help patients devise a plan to incorporate their knowledge into their lives. As a nurse, everyone learns to identify the patient's willingness to learn and motivate their interest in learning. Comparing a realistic desired level of health with the actual state of health enables the nurse to identify deficits and needs and then plan an effective teaching program. An educator must be knowledgeable about the subject matter and patient teaching principles in order to provide individuals with guidance, appropriately set the learning pace, and creatively introduce concepts to successfully achieve the objectives of new knowledge, behaviors, or changed attitudes. Nursing education is most effective when it responds to the patient's or the learner's needs. An educator assesses the learner's needs by asking questions and determining the learner's interest. The Joint Commission's Speak Up initiative. S. Speak up if you have questions. If you still do not understand, ask again. It is your body and you have a right to know. P. Pay attention to the care you get. Always make sure you're getting the right treatments and medicines by the right healthcare professionals. Do not assume anything. E. Educate yourself about your illness. Learn about medical tests that are prescribed and the treatment plan. A. Ask a trusted family member or friend to be your advocate or supporter. K. Know which medications you take and why you take them. Medication errors are the most common healthcare industry mistakes. U. Use a hospital, clinic, surgery center, or other healthcare organization that you have researched or checked carefully. P. Participate in all decisions about treatment. You, as the patient, are the center of the healthcare team. Feedback reinforces health behavior and it promotes continued self-management. The nurse needs to provide feedback both during and at the completion of each instructional encounter. The feedback needs to affirm the level of success of the learner in achieving the objectives, which would be the learner successfully verbalizes information or provides a return demonstration of the skills learned. The feedback the nurse receives from the learner is also important because it indicates the effectiveness of the instruction and whether the nurse should modify their approach. Learning occurs in 3 different domains. Cognitive, which is understanding, affective, which is attitude, and psychomotor, which are motor skills. Most effective learning takes place when all three of these domains are used. Cognitive learning occurs when an individual gains new information to further develop their intellectual abilities, mental capacities, understanding, and thought process. Affective learning is the expression of feelings, emotions, and the development of values, attitudes, or beliefs. Psychomotor learning involves the development of manual or physical skills, like learning how to walk, type on a computer, take a blood pressure. There are different domains of learning in Bloom's taxonomy. Remember is no more than recognizing information. Understanding is being able to figure out why the nurse does what the nurse does. Applying is using the information gained through a procedure of execution or through implementation. Analyzing is breaking material into parts or concepts, and then determining how they interrelate with each other. So think of using the nursing process and taking all of the cues and putting them together. Evaluate is making judgments on criteria and standards through checking and critiquing. Create is pulling elements together and forming a coherent and functional whole, reorganizing into a new pattern or a structure through generating, planning, or producing. A patient newly diagnosed with diabetes needs to learn how to use a glucometer. Use of a glucometer constitutes affective learning, cognitive learning, motivational learning, psychomotor learning. The answer is D. Psychomotor learning involves acquiring motor skills that require coordination and the integration of mental and physical movements. An example would be using a glucometer. Patients need knowledge for survival. This provides a stronger motivation to learn than the patients who need it to actually promote health and wellness. No therapy has an effect unless the person believes that health is important and that the therapy will improve their health. Learning theories focus on how individuals learn. Theories are typically based on learning research. The use of theory facilitates the teaching learning process by creating the desired climate for learning and guiding the selection of instructional strategies. Social learning theory is one of the most useful approaches to patient education. It considers the personal characteristics of the learner, behavioral patterns, and the environment, and it guides the educator in developing effective teaching interventions that motivate and enhance learning. According to social learning theory, a person's state of mind and intrinsic motivational factors will influence their behavior and reinforce the behavior as well as the learning. The access model is the assessment of the patient, the communication with an awareness of many variations in the responses, cultural negotiation and compromise, establishing a respect for individuals' beliefs and values, sensitivity to diverse cultural backgrounds, and safety that enables individuals to feel culturally secure. An individual's involvement in their own learning implies an eagerness to acquire new knowledge or skills. The nurse uses developmentally appropriate food models to teach healthy eating behaviors to the school-age child. The readiness to learn is based on the patient's willingness to engage in learning. An attentional set is the mental state that allows the learner to focus on and comprehend a learning activity. A patient's developmental and cognitive, as well as physical capabilities, influence their ability to learn. The learning environment is a significant factor that affects the learner's ability. The cognitive development of an individual influences their ability to learn. The capability for learning and the type of behaviors that children are able to learn depend on the child's maturation. Adults tend to be self-directed learners. They often will become dependent in new learning situations. The amount of information the nurse provides and the amount of time the nurse spends with an adult learner varies depending on the learner's personal situation and readiness to learn. Adult learners are more successful when they view the information as personally relevant and important to their daily life. Health literacy pertains not only to a patient's ability to read and comprehend health-related information, but it's also having the skills to problem solve, articulate, and make appropriate healthcare decisions. The readiness to learn also depends on the patient's level of physical development and overall physical health. The ideal environment will assist a patient to focus on the learning task. The number of people included in the teaching session, the need for privacy, the room temperature and lighting, noise, ventilation, and furniture in the room. These are all important factors when choosing a setting. Assessment is our first phase in the nursing process. The nurse applies the nursing process and uses critical thinking whenever they approach the care of their patients. The nursing process provides each nurse with a clinical decision-making approach to assist them to develop and implement an individualized plan of care for their patient. The nurse should assess the following: the behavior of the individual, attention span, ability to concentrate, the health beliefs and socio-cultural background, the values, traditions, perception of the severity and susceptibility of a health problem, and the benefits and barriers to the treatment, the identification of the patient's goals for learning, which must originate from the patient and not be imposed from anyone else, the perceived ability to perform the behaviors, their desire to learn, the learning style, the attitude about the healthcare providers, their strength, endurance, movement, dexterity, and coordination, the sensory deficits that might affect the inability to understand or follow instruction, the individual's reading level, the developmental level that influences the selection of the educational approaches, the patient's memory, knowledge, the patient's pain, fatigue, or depression. All of these should be considered when doing the nursing assessment. What are the learning needs of this patient? After assessing information that is related to the patient's motivation, readiness, ability to learn, and then interpret the data and cluster assessment findings to form a diagnosis that reflect the patient's learning needs or factors affecting their ability to learn. These are some nursing diagnoses that are related to education for the patients. After After determining the nursing diagnosis that identifies the patient's learning needs, develop a teaching plan, determine goals and expected outcomes, and then involve the patient in selecting learning experiences. The expected outcomes of the education plan are the learning objectives. The learning objectives guide the choice of the teaching strategies and the approaches used with the patient. Implementation involves believing that each intervention with the patient is an opportunity to teach. The nurse will use evidence-based interventions to create an effective learning environment. Teaching postoperative care while walking with the patient uses time efficiently. Active participation is the key to learning. People learn better when they are more than one of the senses is being stimulated. Audiovisual aids, discussions, role-playing are good teaching strategies. Through active participation and experiencing the learning event, the individual is more likely to retain the knowledge. Patients that have low health literacy, illiteracy, and learning disabilities have an impaired ability to analyze instructions or synthesize any information. Many patients have not acquired or are unable to acquire problem-solving skills of drawing conclusions and inferences from experience, and they don't ask questions to obtain or clarify information that has been presented. Children, adults, and older adults all learn differently. The nurse adapts the teaching strategy to each learner. Children pass through several developmental stages, and in each developmental stage, children acquire new cognitive and psychomotor abilities that respond to different types of teaching methods. And this information that the child has obtained will be carried with them throughout their life. During a teaching session, the nurse tells a patient with a recent neck injury that damage to the nerves is comparable to a water hose that has been pinched off. During this teaching session, the nurse is using the process of analogy, discovery, role-playing, or demonstration. The answer is A. Analogy is used to compare a situation with another situation that may be familiar to the patient to help with understanding. The nurse should tailor her plan for the patient based on the information obtained. Oftentimes, there are people who are successful at sticking to an exercise plan when they exercise with other individuals. Therefore, maybe the nurse helps the patient develop an exercise routine that includes people that are close to her. Evaluation helps the educator determine the adequacy of teaching. Teachback is a closed-loop communication technique that assesses patient retention of the information given during a teaching session. To perform teachback, ask the patient to explain material that was discussed, maybe role of a diet and exercise to manage blood glucose level, or demonstrate a skill, maybe self-monitoring of the blood glucose. The response will permit the nurse to determine the degree that the patient remembers and understands the information that was taught or demonstrated.